We just finished talking about your breast cancer and your treatment options. Do you have any questions?
Wow, it's so overwhelming. I don't know what to choose. I don't even know what treatment to do. What would you suggest?
Well, the most important thing is that you choose a treatment that you feel is right for you. How can I help you make that decision?
I don't know what all this means. What is chemotherapy or radiation or whatever you call it? Or, in fact, what is cancer? All I know is I just don't want it. Let me try to explain.
What is cancer? Cancer can be explained by comparing it to a bag of oranges. If you have one orange that has a section that is rotten, you can remove that slice and eat the rest. Sometimes you open an orange and you notice that multiple sections are rotten or that the peel is rotten too. If you leave the rotten orange in the bag, the other oranges will also become rotten. Cancer in situ is like the orange with a rotten section. That section is rotten, but it has not caused the other wedges to become rotten. It also has no way of spreading to the other oranges. Cancer in situ also cannot spread to the rest of the body. Invasive cancer is like the orange that has multiple rotten sections. The cancer grows and invades into the tissue surrounding it. Invasive cancer can spread to other parts of the body, similar to the orange causing the surrounding oranges to become rotten. When cancer spreads to another part of the body, it is called metastasis. Invasive cancer can grow out of control and can spread to other areas of the body. Cancer is bad because it makes the other tissue where it is growing unable to perform its normal function. What does breast cancer feel like? Most people who have breast cancer don't feel sick. Sometimes they have a breast lump, sometimes not. Some breast cancers are only seen on mammograms. Mammograms are important because they can find cancer when they are small and save lives. Many women who are diagnosed with breast cancer find it hard to believe because they feel perfectly normal. How is breast cancer diagnosed? Breast cancer is diagnosed by taking some of the tissue out of the body and looking at it under a microscope. Removing tissue from the body like this is called a biopsy. Biopsies can be done with a needle by cutting a small piece of tissue or by removing the tissue. If a cancer diagnosis is made, it is sometimes necessary to look for metastasis in the rest of the body. This is usually done with special X-ray exams or other tests in the radiology department. How is breast cancer treated? There are two goals of breast cancer treatment. The first goal is to control cancer in the breast. The second goal is to control any cancer that might exist in the rest of the body. Surgery and radiation work to control the cancer in the breast. Chemotherapy and hormonal therapy are used to help treat the whole body. Surgery. People who have breast cancer usually have two options to treat the breast. One option is to remove the breast. This is called a mastectomy. The other option is to remove the part of the breast where the cancer is. This is called lumpectomy. Women who choose a lumpectomy need to be willing and able to undergo radiation therapy. Women who receive a mastectomy and women who receive the lumpectomy with radiation have the same chance of surviving. No matter which operation you choose, your cancer can come back. Surgery is also important to find out if the cancer has spread. This is done by checking the lymph nodes. The lymph nodes help drain extra fluid in the body, and they also are part of your immune system. When breast cancer spreads, it usually is seen in the lymph nodes first. Breast tissue usually drains to the lymph nodes in the armpit. There are 2 ways to check the lymph nodes to see if they have cancer. The first is to remove most of the lymph node in the armpit. This is called an axillary dissection. This procedure can diagnose if cancer is in the lymph nodes. The bad thing that can happen with the axillary dissections are weakness of the shoulder, pain or numbness of the arm, and swelling in the arm. If any of these things happen, they can be permanent. This can affect the use of your arm. The second way to check the lymph node is called a sentinel lymph node biopsy procedure. With this procedure, usually 1 through 3 lymph nodes are removed. First, your surgeon will inject your breast with a liquid that contains a small amount of radiation. Next, a blue dye is injected into the breast. During the surgery, a special instrument that detects radiation is used to identify the lymph node or nodes that drain the fluid from your breast. Only the lymph nodes that feel abnormal, are blue, or contain radiation are removed. The idea is that the same lymph nodes that drain the breast cancer will also drain the injected fluid. If these few lymph nodes do not contain cancer, then the other lymph nodes are unlikely to have cancer. If the sentinel lymph nodes contain cancer, then the other lymph nodes will likely need to be removed. The sentinel lymph node procedure decreases the chance that the surgery will affect your arm or shoulder in the future. The procedure will make your urine look blue or green for a short period of time, but that is expected. There are some special situations in which a lumpectomy is not safe. If that is true in your case, your doctor will explain it to you. Radiation therapy. With radiation therapy, strong X-rays help kill cancer cells that might remain in the area of the breast after the surgery. Radiation therapy does not treat the whole body. It does not make your hair fall out, and it does not make you feel sick. Radiation therapy can cause a reaction in the treated area that is similar to a sunburn. It usually makes the skin thicker and darker. Many people feel tired during the treatment. The treatment lasts for 6 weeks, Monday through Friday. This treatment can be inconvenient. Radiation therapy is necessary for women who have a lumpectomy. It is also used for women who have aggressive or advanced breast cancer. Chemotherapy. Chemotherapy is a medicine that is injected into your blood to help treat cancer cells that might exist in your whole body. Chemotherapy is used to help improve the chances that you will survive your breast cancer and reduce the chance that it will come back. It also can shrink the cancer in your breast so that the surgery will have a better cosmetic result. Chemotherapy for breast cancer makes your hair fall out. It can make you feel sick. The treatment is usually given for 6 months. Hormonal therapy. Some breast cancers have the ability to grow faster in the presence of the female hormone estrogen. If your cancer has this feature, you may be advised to take a pill that helps to block estrogen. This pill does not make your hair fall out and does not make you sick. Like chemotherapy, it can help improve your chances of surviving your breast cancer and reduce that chance that it returns. Targeted therapy. Targeted therapy is medicine which kills cancer. Your cancer can be tested to give your doctor a good idea about whether a targeted therapy will work for you. This allows your oncologist to tailor a program that is right for you.
Well, I think I understand better what breast cancer is and what I can do to treat it.
That's great. Do you feel ready to make a decision about your treatment now?
I understand much better, but I think I want to go home and talk to my family about this.
That's a really great idea. Make sure to write down any questions that you have so that we can talk about them when you come back next week.
Okay. Thank you very much. You're welcome.